KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. Eye doctors today perform surgeries that would have seemed unthinkable a century or two ago. They can remove cataracts, or correct someone's vision with Lasik surgery, or do a cornea transplant to relieve pain or restore someone's sight. But one procedure they can't do at the moment is a full eye transplant for vision restoration. And that prevents doctors from treating some more serious eye conditions. Researchers at the University of Colorado Anschutz Medical Campus want to change that. A team there has recently been awarded up to $46 million to figure out how to make successful eye transplants a medical reality. Dr. Kia Washington is leading the team's research, and she refers to the project as a moonshot.
I call this a moonshot because obviously it's a high risk and high reward, but also because I feel that we're shooting for the moon and we're going to land somewhere among the stars. Maybe we're not going to achieve our goal, but because of what we're doing, something great is going to come out of it.
We'll start our conversation with her explanation of why an eyeball transplant is so complex, even in an era when organ transplants are fairly common.
It's essentially because of the issue of actually restoring vision with the optic nerve. So the issue is that you're cutting the optic nerve. So you're causing trauma to the optic nerve, or essentially the brain. And then you're sewing the optic nerve together between the donor eye and the recipient patient. And so the nerve has to regrow essentially over what is a gap. That's what makes it harder than other transplants. So, if a kidney transplant, mostly if you restore blood flow, the kidney will function. And also with the liver, if you restore blood flow, the liver is for the most part going to function. So that's like the crux of our research, is putting together different therapies that have shown promise, but we're kind of putting them all together to help the optic nerve regrow over this gap.
Okay.
That is where the big science comes in. The eye is, again, essentially the brain. And so that's why it's different than other organs.
We already have methods of transplanting corneas or portions of the optic nerve that can help restore a person's sight. Why focus on transplanting an entire eye?
Well, because we haven't really been able to restore vision in a lot of different conditions. We feel that giving the body fresh tissue, in particular in the setting when the eye has been damaged or there's trauma to the eye and you have no other option, we're giving the body fresh functional tissue. And because there are some diseases where the optic nerve or the retina have degenerated or been destroyed, and you really don't have the option of restoring vision in that way.
What conditions is an eyeball transplant most likely to help?
I would say initially it would help someone that has had a trauma to their eye and they now have blindness. If they have one good functioning eye, we would not recommend this.
Right.
But if someone has blindness, in particular from injury, those, in my mind, would be the first candidate. My initial funding was from the Department of Defense, and most of my work was done with the thought of wounded service members that have had ocular trauma from combat. And that's because those people actually don't have their eye tissue. So we're actually replacing their damaged tissue with tissue that's alive and can function, ideally can function. And then there could be patients suffering from other diseases, which are main causes of blindness, like diabetic retinopathy or glaucoma, which are situations where the eye tissue responsible for vision really isn't alive anymore.
Now, Dr. Washington, you're an expert in hand transplants, which are complex, at least in part because of all of the nerves involved. How does that experience help your research team find an innovative way to make eye transplants a reality?
So when we're dealing with a hand transplant, you have a lot of different tissue types. You have muscle, you have bone, you have nerves, and you have small vessels. In the same way, eye transplant consists of a lot of different tissue types. We have nerves, we have muscles, We have different components of the eye, and we have small blood vessels. And so learning about eye transplantation and also the way the body accepts an eye transplant really is translatable to my past experience with hand transplantation.
What level of vision restoration do you hope for? Do you think patients will be able to regain clear 20/20 vision, or are we talking more about the ability to see shapes and colors?
Right. I think we don't really know.
Not yet.
Not yet, at least. Obviously, our goal is to restore the best vision possible. Of course, we're shooting for the optimal vision that we can, but essentially something that's going to help people live a more whole life. So, if it's at first just light perception, that may be the first goal.
Well, we've been talking here about restoring a person's vision. What about people who were born blind? Could this be an option for giving people sight who have always been blind?
I would say that it could be an option. I would say that's, very far off in the future.
Sure.
I think, what we're doing again is a moonshot. So this is just restoring vision for people that have had vision
Okay.
is within itself a challenge. Once the therapy has been developed, that's not out of the picture, but those would certainly not be the first candidates.
Your team is setting out to fix eye conditions that are essentially unfixable at the moment. How huge would eye transplants be for medicine and for humanity?
I mean, it would be very huge. So the statistics sometimes change, but about 3 million people suffer from blindness in our country. And if you consider the world, statistics of 40 million have been quoted. Vision loss affects a lot of people throughout the world. And, is also a big cost to families emotionally and financially to support people that have vision loss, and obviously a big emotional loss for that person. So it obviously can really help a lot of people.
Dr. Kia Washington is professor of plastic and reconstructive surgery at Anschutz Medical Campus. You'll find more information and a link to some of the research in our show notes and at kunc.org. Before we go, I have a favor to ask. Here on In The NoCo, we work to share the interesting and important stories that make life in Colorado so colorful. That takes resources to research, interview, edit, fact check, and assemble what you hear on the show. And those resources come from donations from our listener community. Because you enjoy listening to In The NoCo, make a contribution of support at kunc.org/donate. With the end of 2024 approaching, please give a gift now and hear the impact on In The NoCo in the year ahead. Thank you and happy holidays from all of us here at In The NoCo and KUNC News.